Hi guys, welcome to the Kratos Medical Podcast. My name is Greg, I'm one of the doctors working at Kratos, and today we're going to be looking at cardiomyopathy in bodybuilders. Okay, so it's well established that anabolic steroids are a cause of cardiomyopathy in bodybuilders. Okay, so this is the enlargement of heart muscle, okay, and that's in response to exogenous testosterone. So that is bodybuilders taking lots of anabolic steroids. The heart muscle contains androgen receptors, so they are as sensitive to androgens, or testosterone in this case, as any muscle tissue would be. It is a paper on reversible cardiomyopathy in anabolic steroid use. It's a case report on a single patient. Okay, so this patient attended the emergency department. He was a minor, age 46, and has had a 12-year history of anabolic steroid use. He came into the department short of breath and had a full sort of workup. He had a clear chest on a chest X-ray. When the doctors listened to his chest with a stethoscope, it appeared all clear. However, on the ECG, it did show the possibility that he had some heart enlargement. And following on from that, he went on to have an echo scan which showed a biventricular, so both sides of the heart, both ventricles being enlarged, cardiomyopathy, which they graded as severe. Okay, so that means that the breathlessness was the result of the heart being unable to keep up with its normal demands. Okay, so this is a direct correlation, direct link from the fact that this gentleman has overused anabolic steroids for a long period of time. The patient's blood tests showed that he had an elevated testosterone level and a elevated hemoglobin level, so the blood becomes more concentrated in hemoglobin. Okay, this is why in some cases bodybuilders need to have blood removed to prevent things like stroke. He also had a atrial fibrillation noted on his ECG, as well as the large complexes seen which were suggestive of a heart enlargement. So this is a funny heart rhythm. Okay, so it's where the heart is considered to be irregularly irregular, so it's beating in a very regular fashion. Okay, this is likely contributed to the patient going into an element of heart failure, which is given his symptoms with which he's presented to the hospital. The patient went on to have a medication called a beta blocker and was sent home to have further, more in-depth scans at a later date. When the patient went on to have a cardiac MRI then to test the patency of the coronary vessels, it was seen that he didn't have any coronary artery disease, which was really lucky in this case, because see an earlier YouTube video of mine which shows that up to 25% of young anabolic steroid users could potentially have atherosclerosis or coronary artery disease early on in life. Okay, so the patient was started on a beta blocker to slow his heart rate down. He was started on a blood pressure medication called spironolactone, and he was started on an anticoagulant, which is a blood thinner, okay, called rivaroxaban. The patient then underwent a procedure to normalise his heart rhythm back from atrial fibrillation into what's called sinus rhythms. That's your normal heart rhythm. Okay, and then the patient underwent serial ECGs after coming off all testosterone. Okay, and the good thing about this case is that it highlights that actually in the subsequent months this patient actually went on to have a normal ejection fraction on a scan, which means that further jelly scans of his heart showed that the heart had undergone a concept of remodeling and had gone back to its normal size, normal functionality. Okay, which is really positive result. And this case highlights that there is an important reversible outcomes for anabolic steroid use as a cause of cardiomyopathy. I think it's important to note here that one of the key differences here is that the patients have a chance of being picked up earlier for this with regular testing, so both bloods and regular ECGs. A recent Canadian study, which I've got more information on if anyone would like to know, showed that in under 65s, 1.5% of all cardiomyopathies are caused by anabolic steroids. Okay, so that's a fairly large proportion of people who are undergoing cardiomyopathies being triggered by anabolic steroids. And this video helps not only clients who might be using anabolic steroids, but also clinicians who might just consider it as a cause for cardiomyopathy that they might see in their clinics. Okay. I think it's really important to note that a good screening test for this is an ECG. Okay, so that's your 12-lead ECG. Those are the 10 leads that are attached to a patient's chest and arms, which produces 12 leads on a piece of paper. Okay, that gives us an idea of the size of the heart as well as the rhythm that the heart is in. I would caveat this by saying, if a company is selling you a ECG device, which is, for example, a single electrode that you stick to your chest, or a band that you tighten around your chest, or a wristwatch, okay, just be mindful that this isn't a true ECG and it can't comment on the size of your heart. So if these companies are making claims to that, be really, really mindful that it's unlikely to be able to provide that kind of reassurance should your heart start to get larger, okay? We don't want to be in this position where this isn't reversible and you've gone too far with your training. So it's highly advisable to engage with your healthcare practitioners and get screened. So whether that be ECG and blood tests, okay? If the need arises, potentially an echo, which is a jelly scan of your heart, just to see how big the ventricles are, the atrium are, how well the heart is functioning, and the flow through the heart, okay? So it's a really detailed scan, which gives us a lot of information. Nice quick knowledge blast today, just to give you some good news about some of the things that have been coming forward in the research, which shows that some of the damage produced by anabolic steroids is reversible. It's also important to note that this patient, when he was removed from his anabolic steroids, was put on a TRT dose, so a testosterone replacement therapy, to have a normal physiological level of testosterone. Okay, and the gentleman did well on that. Okay, so it's not that he was removed from all testosterone completely and was left to suffer. However, it's worth pointing out that this study did take place in America, and in the UK it is somewhat difficult for patients to access a testosterone replacement therapy on the National Health Service. Okay, in that case you want to be looking at a private provider who'd be able to provide blood testing and the medications itself by prescription and monitor you throughout your recovery. As always, if there's any questions, feel free to approach, guys. Thank you for your time. Have a great day.